Hello everyone, and welcome to our webinar on our new practice guide called Medical Homes and Primary Care. This is a partnership with the Department of Early Learning, Early Support in Infants and Toddlers program, and the Department of Health, Healthy Starts and Transitions. So we're going to introduce ourselves and then get an idea of who's on the call with us today. So this is Debbie Donnellan with ESIT.
Adrienne O'Brien with ESIT.
I'm Allison Shee with the Department of Health.
Kathy Grant Davis with ESIT.
And Meredith Kyle with the Department of Health.
Okay, so what we're going to do first is a poll to see who's on the call with us, and we wanted to find out what your role is in the early intervention field. Okay, so, all right, it looks like what we have is 70% family resources coordinators, 13, and we gave you the option to choose more than one, 13% early intervention service providers, 39% program administrators, and 4% interested partners. So that's great. I'm glad to see a lot of family resources coordinators on here because it directly relates to your role. And also, you know, service providers and program administrators, that's great. So a couple logistics about today's webinar. We are recording so that folks who are not able to join us live can hear and learn more about the practice guide. You're all going to be muted because we did have a large number of people sign up. If you have a question or comment as we go along, please use the question box to type it in. Meredith will be keeping an eye on that box. We're going to try to wait until the end to answer the questions, but also let us know throughout if there are any issues with the audio or visual. And just going to touch on our objectives for today's webinar. So we have an hour. We want to talk about the importance of the medical home model of care for infants and toddlers with disabilities that we serve. And we want to review the new practice guide, and then we want to discuss how to share this information with parents. And I'm going to turn it over to Allison to give some background information.
Thank you, Debbie. So I am Allison Shee, and I am a grant coordinator at the Department of Health. And the grant that I coordinate over at DOH is called Great Links, and it's a 3-year HRSA grant. Aimed to integrate services that work with children with special health care needs. And so this grant started a little over a year and a half ago, so we're in the second half of the grant. And some of the goals of those grants is to create a statewide shared resource for children in need of special health care needs. So we're working with Within Reach and the Family Health Hotline to do that. We are working to increase the use of shared plans of care within a subpopulation. So we're working with the maxillofacial review boards across the state. And the last goal is to increase the amount of children who have a medical home. And that is what we are working on with ESIT with this practice guide that we are presenting today. And so who are children with special health care needs? These are kids, and they are kids that also happen to need extra care. So we consider these to be kids who have an increased risk for chronic physical, developmental, behavioral, or emotional conditions, require health and related services of a type or amount beyond which is normally required by children. And essentially, basically, these are all kids served by you guys at ESIT. So this guide is around medical homes. So what is a medical home? A medical home is an approach rather than an actual place. And according to the AAP, it's a model of care that's accessible, continuous, coordinated, compassionate, comprehensive, culturally effective, and family-centered. And so we know from the National Survey of Children and Families that only just under half of Washington families report having a medical home. So at the Department of Health and at Dow, we work to increase that percentage in Washington. And so this is just kind of a busy picture, but the main point of this picture is that a mom was asked to map out all the services that work with her family, with G being her child in the center, and her family being the little circle around. And these are all the different organizations or systems that she has to work with to support G. And so if you see, this is actually very well organized, I guess because mom did it, but there's a lot of things and coordination that go into taking care of a child that has special health care needs. And so just when we talk about medical homes and who that encompasses and what that entails, usually we see some common players. For one, ESIT, Early Intervention Services, you guys are a big part of that. We have the Medicaid Managed Care Coordinators, the Children with Special Health Care Needs county coordinators at the local health jurisdictions, neurodevelopmental centers, and we have 18 across the state of Washington, and primary care providers, which we're going to talk a little bit about today. So I'm going to hand it back over to Debbie.
Okay, so now we'll talk more specifically about the actual practice guides, and these are the components of it. So we have the actual practice guide called Medical Homes and Primary Care. Appendix 1 is some background information and goes into more detail about the model of care or the concept of medical homes. Appendix 2 is a handout to give to parents, and it's written in parent-friendly language, and Adrian will talk more about that handout later. Appendix 3A, and I see a typo, 3A and 3B are the medical home brochures in English and Spanish that can be given to families. And then we've created an optional form for your use for communication with primary care providers, and we'll talk about that more as well too. I want to show you that these materials went out in an email yesterday to the field, so you may have received that. And they are also attached as handouts to this webinar, so you could download them while you're on the webinar. And then another way to find our practice guides is on our website. So what you would do is go to del.wa.gov/ESIT, and that's our homepage on the Department of Early Learning website. You would click Information for Early Intervention Providers, and then the very first link is Training and Professional Development for Early Intervention Service Providers. So you click that, and you may want to bookmark this page because a lot of materials are here. If you scroll down, we have all of our practice guides, another new one that was just released recently on sensory disabilities, and then here we have the practice guide for medical homes and primary care. And one thing that we wanted to talk about with you is the feedback loop that ESIT is committed to so that we can incorporate stakeholder feedback in the development of practice guides. We actually just finalized this process, but we did go through this exact process for this practice guide. And so, here at ESIT, we're very committed to incorporating stakeholder input in our guidance. We had a draft at a local lead agency meeting where Allison came in both East Side and West Side, and we got input from family resources coordinators. The team of both Department of Health and ESIT incorporated that feedback and sent another draft to the field, and then incorporated additional feedback. And then this is the final draft that we're sharing today. Well, it's really the final product that we're sharing today. And just some of the feedback that we got right from you was, a really important one was to create a one-pager for families to kind of explain this process. So we did that, and you'll hear more about that later. If you print it double-sided, it's one page. We tried to keep it to one page, but it's two. But there's a lot of great resources on it. We got more feedback was to get input from the Family Leadership and Involvement Committee on that one-pager. And so we did this same cycle that you see on the screen with our FLIC members, where we had a draft with them, we got their feedback, we had another webinar to go through and get more feedback and incorporate that. So we're really happy with the parent information sheet, and we're appreciative of the FRCs for that idea. We also just added some content to the practice guide about why we were doing this, some more information about, why we want children to make sure that they have primary care and or a medical home. We made some of the wording more concise. We changed some of the wording so that it more accurately reflects what's happening in the field. And that's why your input is so important, because you're there doing the work day in and day out. And we added some resources directly to the practice guide. So we're going to do another poll, and to hear from you, have you ever helped a family find a primary care provider? So this is just a yes or no, and just take a moment to select yes or no. Okay, thank you. So look, the majority, more than 3/4 of you have helped a family find a primary care provider. And if you haven't, it may have been that you just haven't met a family that needed to find a primary care provider. But what we want to acknowledge is that you're already doing much of what this practice guide talks about. It's just putting it in writing. So we know that this is part of Family Resources Coordination. It's really part of the FRC responsibility to help families access community resources and support. And we know that often you're doing that. So hopefully, because we've gathered input from you, this just puts into practice, kind of a snapshot of what's already happening. So we're not going to go through word for word the whole practice guide. Oh, I was going to show it to you. So this is what it looks like. It's 3 pages, but the 3rd page is references with the federal citations. So really the content is these 2 pages. And so I'm just going to kind of break it down and walk through a few of the components. So the first step would be if the family comes to you to early intervention and does not have a primary caregiver, or primary care provider, sorry. And so these are some of the steps that the FRC would need to take. You could use this decision tree to help walk you through the process. And what we heard from you is that if a family is coming to you without a primary care provider, it's often because they've just moved into the state or into your region. And so, they're probably needing help with finding a number of resources. But the first thing you could find out is if they have health insurance. And then the flow chart shows you kind of the path that you can go if they don't, for how to help to locate health insurance. And then once they've obtained health insurance, to try to find a primary care provider. What's not in this screenshot are a couple points, again, that came from your input. So we know that FRCs are not able to make recommendations for any specific primary care provider or insurance provider over another. So really the role is to provide support to the family during the process. If the family really wants to hear from someone else about their experience with a doctor or with insurance, maybe parent to parent might be a good link for them, where they can talk with another parent who's been through the system. And then we've also included the resource of the Family Health Hotline and the website Parent Help 123, which is within reach, which has health insurance navigators that can help walk a family through enrolling for health insurance. And they can also help a family look for primary care providers in their area. Okay, before we go on to the next section, we have another poll for you. And there's different names for this type of outcome. Some people call it an FRC outcome, or a community resource outcome, or a family outcome. So whatever you call it, have you ever written an outcome around helping support a family to locate resources? And it's just another simple yes or no. I'll just give you a minute. Okay. So again, well, in this case, about 2/3 of you have written one of these outcomes. And that's really good to see, because we know that they're not used frequently. They're kind of statewide, more rarely used. But they're really a way to capture all of the behind-the-scenes work that the FRC is doing that may not show up in the child outcome. And so what we talk about in the practice guide is that if the family does not yet have a primary care provider, and you haven't identified one for the family, with the family by the initial IFSP, you can offer to write one of these FRC community resources and support outcomes to assist the family. We got input from some of you that this process might already have been done by the time of the initial IFSP, so that's why we kind of clarified, if they've already located a primary care provider, you won't need to write an outcome. And also we want to say offer to write an outcome, because really it's up to the family what outcomes are on their IFSP. But what we provided is an example of what that outcome could look like. And it would talk about the FRC supporting the family. For number 3, we talk about the family researching outcome options and making an appointment with the primary care provider they choose. And we highlight that the FRC can assist as needed. So it really depends on the level of needs that the family has. They may be able to do this all on their own with just some resources, or you may want to sit with them side by side and do it together. I want to share another component of the practice guide, which would be appendices A and 3A and 3B around brochures. And so if you go to this website, medicalhome.org, right here, there is a brochure in English and Spanish. We also have them with the materials on our website. And so this can be provided to the family. This is what the English one looks like. And also on their website, there's brochures in 6 other languages. They still have pretty much the same content, but they're not as up to date as the English and Spanish ones, and those can be found on that second link there. So another poll for you is, how do you share information back with primary care providers? And so we only have the option to select one. So do you, perhaps you don't routinely share information, or you might share that, kind of a referral feedback that the child was enrolled. Some of you might share the full IFSP, and we learned that some of you have kind of created a summary letter that you send. Okay, so really only a very small percentage share the full IFSP. About 35% share summary, 17% only eligibility status, and 43% do not routinely share information. So, we hear a mix from FRCs. We know that some of you routinely are sharing information. We originally had in this practice guide the idea of sharing the full IFSP, but then we learned that physicians don't necessarily want the full IFSP. It's too lengthy. And so we've adapted the guidance to share, kind of whatever you agree on with the physician in your local community. And so when the family does have a primary care provider, we need to ensure that the FRC is sharing information back to help with continuity of care. And so, again, you would need to have family permission to do this. And so you would offer the family release of information to be able to communicate with the primary care provider. If the family consents, then we would want you to inform the primary care provider of the child's enrollment status, share the IFSP, or at minimum an eligibility and summary of services pages from the IFSP, or if you've already created a summary letter, you can share that as well. Share progress as needed, if there are big changes that need to be shared, and then inform them of changes to the child's enrollment status, so if they're no longer enrolled. And we created an optional form to help you with communication and that you can adapt to your needs, so Adrienne will walk through that later. And then you can talk with them about the medical home model of primary care. So you can talk with the family about what they might want to ask when looking for a primary care provider to see how that fits with the medical home model. And again, Adrienne will talk about that more with the parent information sheet. So I'm going to turn it over to Adrienne.
All right. Because it's so important to be sharing information back and forth with the primary care provider, we created a form that will hopefully make that process easier. So I'm just going to pull that up. So this is, again, included with all the documents for the practice guide. And we created this to be a fillable form, so all of these fields are fillable, little check boxes, and it's also completely adaptable. So you can use this form to just, for the purposes of just following up on referrals, or you can include more information and include enrollment status. There's a section down here for other comments from you, or just other information about their services. And then also really important is to include the FRC's information so that it's easy for that primary care provider to contact you if they have any other questions or need any other information. On the second page of the form are just a recap of basically what I just explained, that it can be used as a summary form when sending an IFSP or other documentation, or you can just use this form. Again, like Debbie said, whatever you agree on with the primary care provider, whatever works best for both. And again, parent permission is always required before doing this. And just to use this form in the way that works best for you. So there are a few ideas down here at the bottom. Again, that it's fillable. It's kind of designed to be able to be formatted to fit on your own letterhead. So it has your logo and contact information. Again, you can use the whole form, or you can delete sections. So you can just delete any of these boxes or delete content from any of the boxes. So really we want you to be sharing information back and forth, but it's up to you and the PCP to decide what you share and how often. So this is really meant as an optional tool that will hopefully make things easier. Oh, we went way back. Hold on, let me catch up. Okay, so the next piece is the parent sheet, and so I'll go ahead and pull that up. So essentially, this is all of the same information that's on the practice guide, but in family-friendly language. So again, there's a nice explanation of what a medical home is that's written in a little, in more family-friendly language. We got a lot of feedback on that. And again, those steps, the same steps that the FRC will walk the family through. So it just takes them step by step on what you'll do. And let's see, down here is a really cool addition, questions for families to ask their primary care doctor to help make sure that they're the right primary care provider for them. So, and again, we got a lot of feedback on these questions from parents who are members of FLIC. And so just examples, what is your experience with children who share my child's special needs? Can my child see the same doctor each time? How do I see my child's medical records? Is there an after-hours number I can call? So these are all really important questions to ask on a first visit with a doctor or on a phone call to schedule, just to make sure that they're going to meet your needs. And these really kind of get at the components of a medical home. So even if their provider does not necessarily use that model, they may have components of a medical home. And so that's what it really kind of gets into it in the first paragraph here, to help families understand that they may not be able to access an actual medical home that uses that model, but that it's really about a partnership between the family and their primary care provider. And so these questions kind of get at what kind of services they provide that will make it feel like a medical home. And then again, there are resources. Some of them are the same that are on the practice guide. There's Within Reach and Parent to Parent, resource information for case management through Medicaid or Apple Health for Kids, using the eSIT parent portal. So it has a little blurb about how parents can use that to email their FRC or other members of their IFSP team, and information about children with special health care needs coordinators, and again, those brochures. And the care notebook here at the top, which is really helpful for families to keep everything organized, everything having to do with their child's care.
And so we have another half hour. We don't have to use all the time if we don't need it, but we wanted to allow plenty of time for your questions. And so feel free to, we don't have any questions yet, feel free to type into the question box if you do. You can also raise your hand, and we can unmute you if you have, if you have a microphone, or if you've called in on the phone, we'd be able to unmute you if you'd rather ask your question verbally. So we'll give you a few moments to think about that and let us know. Okay, well, it looks like there's no questions. We wanted to give you enough time, but there's no questions coming in. So what we have a slide with, we have a question. When will this be implemented? Immediately. So, this is yeah, go for it. Let us know as you're doing this if there are any concerns. But yeah. And the question got cut off. It looks like it said more specific, and then it cut out. So, Jana, if you have more to that question, feel free to type that in. We'll give you a minute. We also have our email addresses up here. Kathy Grant Davis and Susan Frank are also program consultants here with ESIP. So if there are your program consultants, you can email them as well. Okay. Glad we could answer that question. Yeah, I think we don't want to make you wait. We will give you the gift of time and that extra half an hour to do all of the work that you have. I know you're busy. There will be a survey that goes out right after we end the webinar, so please fill that out and be honest. And we use the feedback from the surveys to really try to improve on our webinars. So, thank you all very much. Have a great afternoon.